Welcome back to Wake Up with Cheddar. UMass Memorial is in the process of rolling out thousands of doses of the Pfizer coronavirus vaccine after getting its first shipments earlier this week. The first vaccinations took place Wednesday. Thousands of frontline workers in line to get the vaccine. Here's the reaction from one of the doctors at UMass after getting his.
Honestly, feels like a huge weight kind of being lifted off my shoulders. We still have a few months to go, to get everyone vaccinated, and I know the risk isn't zero still, but it just feels so good after fighting this virus for so many months to finally have a vaccine and have a light at the end of the tunnel.
And I want to bring in Dr. Eric Dickson, the CEO of UMass Memorial Health Care. Really great to have you on this morning. That was a powerful reaction from someone on the front lines of this thing. How has the first week of the rollout been going?
Well, it's been not only the first vaccinations going in, but it's been a boost of morale for all of us here at UMass Memorial. The lines to get the vaccine, people are dancing, people are happy. And I haven't seen that in the past 10 months almost, because we've been fighting this horrible disease.
We just saw the vice president get his vaccine publicly on air. We showed it live here on Cheddar, and other networks did as well. Do you think that this will go a long way to help convince a skeptical American public that the vaccine is safe?
I hope so. And I haven't seen the vice president get hers yet. I'd like to see her. We do have a challenge with people of color are skeptical. They often don't trust the medical society and society as a whole. So, that would be an exciting moment for me to see her get vaccinated.
The Pfizer vaccine does have to be kept at these super, super cold temperatures. I think it's like negative 94 degrees. How has that been? Is that a problem on your end? And are you worried about that in terms of logistics?
We're a large research facility, so we have lots of different refrigeration options. So for us, it hasn't been a problem at all. In fact, we keep on saying we'll take more vaccine, we can store more. For smaller places, for clinics, the Pfizer just isn't going to be a particularly good option because you have to be able to maintain that refrigeration chain. So I think that's what's exciting about potentially the Moderna coming out next, because that will be more disseminated to smaller hospitals and clinics and things like that.
How many doses did you guys get, and how are you deciding which of the doctors or whomever else, the hospital personnel, how are you deciding who goes first?
We received what we thought was 1,950 doses, but it turns out if you constitute it just right, you can get an extra dose from each vial. So it's actually more like 2,400 doses that we got, which was great news. And we had to start with our COVID-facing workers. There's one of our ICU nurses. He works in a COVID unit. He does the educational program. So Fred was first at our medical center to get vaccinated, but he's taking care of COVID patients every day. That's who has to be vaccinated first. They went right to the front of the line because we can't have any more of them get sick because then we lose our workforce to take care of patients. So it's pretty exciting, and that there's been like 95% of the people in that phase one have said, yes, I'll take the vaccine.
So I'm just back to what you were saying about realizing that there were extra doses in those vials. It feels like in 2020, nothing has actually gone better than expected. What was your reaction when you heard that there was actually extra vaccine in these vials and that you could potentially vaccinate even more people?
Yeah. Well, at first it was, it's typical that you'll have a little extra because that compensates for any mistake in terms of drawing out the amount necessary for the vaccine. But what our pharmacists were saying is like, I can't throw away this precious vaccine, and I think we can get an extra dose out of each vial. So we went back to the FDA. They said, yes, we're hearing that from others. Go ahead and do 6 vaccinations per vial. And, it was just the first gift of Christmas for us, I guess, to be able to do that. We're pretty exciting.
And just what is the situation at your hospital right now and in your area when it comes to COVID? We're seeing these crazy surges across so much of the country, California pretty much out of ICU beds. What's it like where you are?
Yeah, we're in a similar situation, not quite as bad as California. We've got a field hospital up and running, and we continue to build the capacity there to take patients. For us, we went through this in the springtime. There were really 4 states hit severely in the springtime: Connecticut, New York, New Jersey, and Massachusetts. And so this is a second surge for us, and it's at this point it's just as bad as the first surge. We have hundreds of people in the hospital right now with the disease. Although we're better at taking care of patients with COVID, we have new therapies available, so less of them in the ICU than the first surge, and it seems almost more normal than it was the first time, which it was quite surreal.
All right. Well, great info, and keep up the good work, and just exciting news about this vaccine. Thank you so much for coming on, Dr. Eric Dickson, CEO of UMass Memorial Health Care. Appreciate your time this morning.